Now let's look at it again from the commercial airline industry and compare to what we do in healthcare. So we have significant staffing issues in the hospital and office-based systems now. There's no minimum number of staff that must be present in order for patient care to occur, at least in the emergency department. So we don't schedule patient visits. I wish we could. Some actually do, but that's part of it. That's not all of it. So you can still just walk in. Now, it doesn't matter how many staff there are in a given shift in the department. An unlimited number of patients can arrive, needing unlimited testing and resources. And when it overwhelms the system, administration gets mad and tells us we need to work faster, work harder. Here's some pizza. So if we operated like a commercial airline, we would have twice the number of physicians, nurses, and ancillary staff that we need, just in case something happened to one of them, or if one of the doctors got tired and needed a break, right? Pilots, co-pilots, navigators, they have backup systems and redundancy to be safe. We would have all of our patient encounters scheduled weeks and months in advance. We would make sure that the people who come to the hospital are properly screened and do not pose a risk to anyone. We would make sure that any agitated or violent patient gets immediately removed and banned from ever coming back. We would limit the number of hours people could work and simply cancel cases if the doctors or nurses work too many hours in a row. Oh, sorry, we didn't get your case started in time. We'll do it later. So if the weather is bad or some of our equipment doesn't work, we just shut down, not see patients. When the department got busy, we could double our fees due to the supply and demand curve the rest of the economy is allowed to use. Now let's say someone decided to come to the hospital. They made their appointment, but at the last minute they didn't come. We could still bill them. This would dramatically help increase our staffing with this extra revenue and surge pricing, and still billing people full price who canceled their visit. And also, airlines know where they're starting and where they're ending. We don't. They know the best way to get there and everything else going around them. The airlines prepare the right-sized plane for the distance they're going and the number of people who want to go there. They divert around storms. They get in a holding pattern if the runway's full. In medicine, we often have no idea where we're even starting. Somebody just shows up, can't talk to us, they're unresponsive. And it's unclear if we can get to where we want to be, how many people are joining us, how much help we have, and how many other people are going to be there directing our attention also. So as a general statement, of course we want to be as safe as we possibly can be. We want to ensure good outcomes for patients and limit any potential harms. But there's massive differences between healthcare and the airline industry, and there always will be.